Hi, I'm Marty doing the BLS recertification for 2020. This is a compressed version of basic life support, but I'll be able to give you all the points necessary to complete this course. I'm going to review a few things here. I'm going to do a demonstration. There's a few videos I need you to look into. Videos with Ken Jung giving you the Staying Alive beat, and or the Vinnie Jones, it's the British Heart Foundation. That's another video I would like you to review. Completion cards will happen. American Heart, I'll give those out today with the proper dates and times on them, and or we'll sign up our e-cards that you can apply for through American Heart. So, in order for this to work efficiently, it has to have a team approach. Therefore, the clear roles and responsibilities will improve the outcomes of the situation. First, you evaluate to see if the chest is rising, see if there's any chest movement going on there. Then you check the carotid pulse. Do this for about 5 to 10 seconds to make sure that there's no pulse. Now you have no breathing, no pulse. You're going to call 911, you're going to call for help, and you're also going to ask for a possibility of bringing in an AED. Second, high quality chest compressions. Those start with getting your position here between the nipples, putting your hands in placement here, and going down the proper depth, anywhere from 2 to 2.4 on adults. Children, it's 1 to 1.5, and when you got a baby, you look at the AP and how thick they are, and that's how you're going to evaluate how far, with your 2 fingers, that you're going to do chest compressions. Ratio, 30 to 2. So you got 30 compressions to 2 breaths. The focus here is basically on the chest compressions. Because when you get up into this area and you have compromised airway, it's blocked, obstructed, you might have neck injuries that you have to consider. So your focus is going to be here on chest compressions. Remember not to lean on the chest. It can decrease the refill on the heart. Fatigue can set in, so it's very important that compressors are alternated. That will help decrease the fatigue in the compressor and give better high quality chest compressions. Airway. Everybody knows what the ambu and the mask. Using proper protective devices like a pocket mask looks like this, and or ambu hooked up to your oxygen system. The proper way when you're putting the mask on the victim and you're giving just enough air to see the chest rise. And all the ventilations on anyone, children, adults, and babies, you give just enough air to see the chest rise. Now, if you don't have the ambu or O2, you can come down here and do mouth to mask this way, and or last resort is to pinch the nose, airtight seal around the mouth, and you can give mouth to mouth for your airway. Obstructions. When I go into obstructions, we talk about the Heimlich maneuver. Come around, wrap your arms around the person, and you give up to 5 abdominal thrusts to see if you can expel the obstruction. If it doesn't come out, you put the victim or the person down, you look into the mouth to see if you can see any obstruction. If you see it, take it out. No blind finger sweeping. On the baby, it's the only one that you could take the baby, side back slaps, chest thrust 5 times here. Check the mouth, try the airway. Airway is very important, yet this is where they want you to focus mostly. Next thing you want to do is find that AED. As you can see, the Annie has the AED properly placed, upper right, lower left. This is plugged into the machine, and it's very important that you find the AED as promptly as you can, because it can restore cardiac rhythm on the victim. Follow the prompts. Adult pads, as you can see here, Pediatric pads are this small, they go in the same spot. Pediatric pads are hooked up to the same system, but it has an attenuator that can knock down the joules and give the proper amount of electricity for that child. There needs to be a rhythm for the AED to shock. If the AED analyzes and finds that there's no shock, it will tell you to continue CPR and continue your compressions. If there's a shock, it'll say shock found, or the rhythm is found. I should say the rhythm was found, shock advised. And the team leader will also say, everybody clear. The box or the AED will also tell everybody clear. Everybody clears, the shock is given. You get back immediately on the chest and give you compressions. Under 55 pounds, adult pads are not used. So at 55 and up, that you're going to use the pediatric pads. So, very short, in summary, the sequence to remember is unresponsiveness. There's nothing going on, there's no breathing. Those are the two indicators that you're going to start CPR. You call 911, you call out for help, and you also call or ask somebody to find an AED. Another small note, when it comes to witness and unwitnessed CPR, on all unwitnessed events with children, you're going to do CPR first. Then you get on the phone and call 911. If it's an unwitnessed adult, you walk into the room, they're there, you've done your checks, you call 911, you come back here on the chest. That's it. We'll do a 25-point quiz after this.